right, we are now live on Facebook and all your other streaming services. Thank you all for joining. I'm Jeff Coltin, senior reporter at City and State, and this is the Queens Virtual State Legislative Forum, sponsored by AARP New York. Thank you all so much for attending. We've had similar forums sponsored with AARP in Central New York, Long Island, the Bronx, all over the state. And we're really excited to be focusing on Queens today, truly the epicenter of New York politics lately. So much exciting stuff. Of course, the current governor is from Queens. The soon-to-be former president was from Queens. Now he's from Florida. But just so much exciting stuff happening there. We've got a great group of state lawmakers and advocates here today to talk about everything that's happening on topics like nursing homes, prescription drug affordability, financial security, and so much more. But before we jump into that, I want to, of course, thank our great sponsor, AARP New York, and to throw it to Heather Joseph, the Associate State Director for Volunteer Engagement and Resources with AARP. Heather?
Thanks, Jeff. I'm so glad to be here. As mentioned, I am the Associate State Director for Volunteer Engagement and Resources with AARP. We are glad to welcome everyone today to City and State's Queens Legislative Forum, sponsored by AARP. In a few minutes, I will turn it back over to Jeff Coltin of City and State, and he will introduce our special guests. These are your state legislators who represent you and your neighborhoods in Queens and Albany. Jeff will introduce each legislator and then launch right into questions so we can carve out as much time as possible to hear the positions and plans and priorities in the issues that are important to the 50 plus. I want to emphasize that AARP is a nonpartisan organization. We do not contribute to political campaigns. We do not endorse political candidates. The purpose of today's forum is to solely educate our members and our participants on issues of importance so they are better informed citizens. If we were all gathered in a big room today, like we used to do, I'd ask for a show of hands of how many people have loved ones in nursing homes, or how many of you care for an older family member or a loved one at a home. Or I'd take a moment to ask about who gets prescription drugs regularly. And I would imagine a lot of hands would go up. Nursing home conditions, family caregiving, and prescription drug costs are leading issues for AARP. And today we'll be discussing and asking our state legislators what they're doing or they plan to do about those issues. I want to thank our volunteers and our members from Queens who are in virtual attendance today. And I want you to know that what we are talking about are key issues today. That includes, as you know, our state legislators can attest showing up in their red shirts and making sure our state legislators are aware of what responsive issues we are to the 50 plus. I'm sure they and all our members will be listening carefully and are as anxious as we are to hear from our lawmakers. With that, I want to thank City and State for hosting this forum, and I'll turn it over to Jeff.
Thank you so much, Heather. And for, hey, all of you that are watching us, that are streaming this live, if you're on Zoom, please, feel free to use the chat function. Just make sure that you toggle it to panelists and attendees so everybody can read it, not just us panelists. And if you have any formal questions, I'm hoping to take some questions from the Q&A later in this panel. So by all means, throw those in the official the Q&A section of the Zoom. I can see somebody already has a question in there. And feel free to upvote your favorite questions so they go to the top and I can see them for later. But now, hey, I want to introduce all of our state legislators that are joining us today. We have Leroy Comrie, state senator from the 14th district. Joe Addabbo, state senator from the 15th district. I'm seeing James Sanders on the list. I'm hoping he joins later. I don't see him on the screen, but James Sanders might be joining us later. John Liu, state senator from the 11th district. In the Assembly, we have David Weprin of the 24th district, Catalina Cruz of the 39th district, Nili Rozic of the 25th district, Stacey Pfeffer Amato of the 23rd district, Khalil Anderson, brand new Assembly member of the 31st district.
Welcome.
And I think we have hopefully Ron Kim of the 40th district joining us later. So really a full house of legislators from every corner of Queens that huge, huge borough. And of course, joining us as well is Beth Finkel, New York State Director of AARP New York. So Beth, thank you for joining us. She'll be sharing AARP's perspective. But hey, we have a lot of lawmakers to hear from, a lot of questions. So I want to jump in there and talk about the elephant in the room, the budget, the New York State budget. Budget cuts are likely given the financial situation and the coronavirus pandemic. Opening up to all of our legislators joining today, what will you do to protect services like home delivered meals from cuts? And what do you think is one program in particular that is especially worthy of consideration in the upcoming year's budget? So, what are you going to do to protect services for seniors from cuts? And what do you think is one particular program that really, especially needs to be saved, or one that's really on top of your mind? And I'll start with the top of my screen, actually. Senator Comrie, why don't you go ahead?
Oh, okay. Well, thank you. Thank you, Jeff. I want to thank City and State, AARP, and all of my wonderful colleagues from Queens for being part of this important event. It's a great opportunity to have an open and deliberative dialogue. Just to be specific, and I think that all of the senior programs are important, that especially the home delivered meal program. During the pandemic, my office had, together with other electeds, did a program where we worked with our various senior centers that had been closed down to call a senior. We assigned people to call seniors on a regular basis to check on them since the senior centers couldn't be open. And we did a direct food delivery program during the heart of the pandemic. We started in the end of March, and we didn't finish until September, when our vendors stopped being able to deliver, doing direct food services for people. Food insecurity among seniors is a major problem, and we need to make sure that we target programs to involve that. As far as the overall budget and what we do to save the budget, I think we all are now working hard at trying to find revenues, and we're looking to tax anyone with two legs in the state of New York to find ways to get money to ensure that we can maintain the budget. But I'm hopeful that we will get the relief from the federal government that we need, so that we don't have to permanently cut any programs. Right now, the state has a lot of folks getting delayed funding, and we're trying to do our best to make sure that that funding is only delayed and not permanent cuts. But I know that my colleagues, together with myself in Queens, are trying to work to make sure that we do everything we can to maintain all of the critical programs handling that help our senior citizens within our community, especially in Queens, where we're in different communities and different silos, so to speak. It's important that we do direct services for our senior community. Thank you.
I just want to jump in there real quick to say that I agree with Senator Comrie. He left out one short phrase, and I just want to make sure that we get that in there, because I know he believes it also. We clearly need revenues. We need revenues to save all the senior programs. We need revenues to save our schools, save our hospitals, save our state, really. And in this very difficult time, a lot of people have suffered, but not everybody has suffered. In fact, there are lots of people out there who have done even better in this pandemic crisis that we've been enduring. And those are the people that have two legs that we are going to look to tax. We're not looking to tax everybody with two legs, right? Right. I know that's what Leroy meant.
That's what I meant. Thank you, John.
We're not looking to tax the vast majority of us who have two legs, or if we don't even have both legs. We're looking to tax those who have done far better in this pandemic. And those are people who are billionaires, are multimillionaires, people who, look, if you make over $1 million a year or more, you know what? We're probably going to be asking you to pay more, because we're going through this crisis. It's a crisis not of anybody's making. It's a crisis not of state or city governments making. It's a crisis that we all have to get through. And many of the people who don't make $1 million a year or more, or even close to that, they're suffering. They're on the front lines. They're healthcare workers, they're food workers, transportation workers. And we need them to continue to do their jobs so we can emerge from this crisis as best as possible. So I'm gratified that Governor Cuomo this past week finally said that no matter what, even with federal assistance, we're probably looking at tax hikes. That's what he said. And I'm glad he's finally facing reality, because we need to get back to Albany and raise the taxes on those who can pay so that we can all emerge from this collectively as best as possible. Thank you, City and State.
Thank you
Now,
for
if I
clearing
could,
up. Thank you for
I
clearing
think we
that up. I agree 100% that we need to tax those with good legs, I meant to say, that can pay, that are driving during this pandemic, that are, you know, exactly what John said, those that are doing well during this pandemic and are benefiting, we need to make sure that they contribute more to the state budget. Thank you.
And I think just to build upon my good colleagues, and again, I want to thank City and State as well as AARP. Again, thank you very much for this opportunity. So I think, yes, it is about revenue, certainly. I think after we look at a $178 billion budget and take a look at some cuts that probably could be done, but may not hurt anyone really in our state, the bottom line is we do need revenue. And I am not one for waiting for federal stimulus money that we were supposed to get back in June and August. You know, I think we need revenue. The taxes are going to be something, but unique to Queens and in my district is Resorts World Casino. Resorts World Casino alone has contributed $3 billion to education. And so when we talk about revenue, as chair of the gaming committee for the Racing Gaming and Wagering Committee for the Senate, I'll promote mobile sports betting and the downstate licenses to take advantage and to really maximize the potential for gaming in our state. Again, I think between the mobile sports betting and the licenses, I think we can raise revenue about $1 billion. And again, not only revenue and increased jobs, but it's also about educational funding as well, which I know we all care about. So after we look at the budget, trim some fat, the bottom line is, yes, we need revenue, not to wait for federal stimulus money, but let's look at a myriad of ways that we can raise revenue. And again, I'll support the taxes and I'll support mobile sports betting and the license for the game downstate licenses.
Would love to hear from some assembly members on this topic. You know, what can you do about protecting services from potential budget cuts, and you know, what's one program or some programs worthy of a special consideration?
Yeah, I guess I'm new. Maybe I'll talk and jump in and definitely echo the sentiment of my colleagues in regards to revenue. This is a very unique moment that we're in, and it's going to take a lot of courage for us to ensure that we levy the appropriate revenue streams for folks to protect these programs. We love seniors. We also respected the fact that we have folks who earn a little bit more in the state, but now we're asking for that to come together and folks to pay a little more to protect programs that really keep the lifeblood of our seniors going, including one that Senator Comrie piloted the Access-a-Ride on Demand. I love that program. I think it's great for seniors to be able to get access to Access-a-Ride on Demand as needed, not having to call in 3 days before or 2 days before, as dysfunctional as that system can be. So that program, albeit it was a pilot, I'm not sure where it is now, making that permanent in the budget would be critical for our seniors in this moment. And separate from that, I think we need to also look at food insecurity, right? Creating a permanent solution for food insecurity. A lot of what we saw in my district as I was running and now an elected is folks who are older and traditionally either volunteered at food pantries or were on the line at food pantries now couldn't do either. And so you had food pantries that couldn't open, that vital access points for food could not open because seniors generally ran them. And then you didn't have programs that were able to assist with home deliveries unless it was through an office or through an initiative, but nothing permanent to deliver some of the goods that folks were used to standing online and getting at the food pantry. So food insecurity and definitely transportation via Access-a-Ride are two vitally important issues that we need to protect. And how we protect them is making sure that we raise the appropriate revenues right now in this moment.
Jeff, can I jump in for a second? I know I'm preaching to the converted here. I've worked with almost all of you except you, Assemblymember Anderson, and I hope to work with you in the near future. You all have been very supportive of the budget. to make sure that there's extra money going into home and community-based services. Last year we got an extra $15 million from the budget, and we're very appreciative of that. I just want to, as I know you well know, all of the communities are really suffering now, older adults particularly. And as a matter of fact, the waiting list, which was almost eliminated last year, is now growing again across New York State for home and community-based services. It's up to 11,000, but it's growing really quickly. And just last week, 158 organizations, AARP included, sent a letter on to the governor and leadership about the need for continuity of funding for next year. So I just want to throw that out there. Again, I know that you all have been very supportive in the past, and I'm hearing you all. I know your hearts are all in the right place. I feel like I need to let you know what's going on, this week in letters that just went out about this issue. So thank you.
I think the pandemic exposed a weakness, right? I think we realized that the minute we went working remotely or not leaving your home, especially our more vulnerable population, we can't supply them everything they need. That's where all the food distributions popped up, or how, simple mutual aid societies popped in to help a person get a prescription that they normally would walk to. So I think we made ourselves very vulnerable, and I think we have to reevaluate. I think at any time when we're even your home, when you're out of money, you have to reevaluate. So I hate saying cut, but I think we have to reevaluate your priorities. And I want to thank you, Beth, and AARP and the other groups for sending out what that looks like going forward. Because I think there's the short term of right now, we're still going through the pandemic. We don't know how long it's going to last, whatever, with the vaccines, yay. But if you watch different news channels, so how do we get through the short term? And then how do we sustain that for the long term? Because people might now say, I'd rather get a meal delivered to me 3 days a week. But one of the most vibrant programs I think we have to always save is our day centers, our adult senior centers, where folks can go and have activity. You also represent AARPs over 50. So where's that gap for programs that people are doing? You do amazing advertising. Let people know the programs. Your advocacy, I think, is so key. And I think that's what we learned, that we have to let everybody know the programs. If something we would hit so much in our office was people who didn't know how to get access to food, didn't know how to get a phone call every day they weren't part of JASA, which operates by me, let's say. So I think that's something that we learned our weakness and we have to work upon.
I agree with Stacey, and I think another thing that we really have to think about is, as we're reprioritizing, so that we don't use the word cuts per se, we have to think about the fact that the money that we needed to maintain certain programs and provide those services pre-COVID, it's not the same amount. There are people with more need for services. There are people whose vulnerable life situations are now ever more exposed. So as we're restructuring, yes, we want to tax everyone who is two legs and has some Gucci shoes on them, perhaps. We want to make sure that we are taxing the people who could afford it and who've made the extra money. But I think we all are also very realistic in that even if we get the federal money, even if we are able to do all those taxes, because the need has now changed, there are places where we're going to have to restructure. For me, one of the programs that I think is of the utmost importance is the Nourish New York program. I represent a district with a high number of seniors who are either undocumented, so they don't qualify for any of those services where you would do the home delivery, or seniors who fall right outside that income gap, that threshold to be able to be a part of a senior center. And so what are we going to do with those seniors? They still have to eat. When we had the food pantry here in my office, we had seniors who were coming in wheelchairs with canes, and there were just no other way for them to get food because they felt within those gaps. And Nourish New York is one of those programs who doesn't discriminate regarding income or regarding immigration status, and went to provide our upstate families with a source of income, because we were buying the fruits and vegetables and everything else from the farmers out there to be able to provide and expand the food that's provided here. There's a food pantry that is out of Ron's district that works within mine, because I don't have a permanent food pantry, that has gone from serving 1,000 families, including seniors, a week, to 10,000. in Ron's district plus the vicinity. So for me, while I would love to see more of these services at senior centers happen, one, we don't know when they're going to reopen because we still have to go through this process. And two, I have so many people that even if we were to reopen them can qualify for anything. I got to make sure they're fed first.
Absolutely. Now we've heard from a number of you. I do want to move on to a new topic just so we can make sure to keep it moving. But, you know, I'd like to hear from some of you I haven't heard from, maybe Assemblymember Weprin first on this one. The breaking news today is that New York had its first vaccine delivered, and it's happening all day today. Vaccines are being given out. It's fantastic news. Seniors, of course, will be among the first New Yorkers that are eligible for a vaccine. You all play central roles within your districts. I just want to ask if there's anything being done, you know, in your office or that sort of thing regarding education and access to vaccinations.
Well, I think it's a little too early to determine, but there's no question, that seniors will be, one of the first to get it. Also, those that are medically vulnerable. I did notice through the chat on another subject, came across seniors always vote. And that is true. And that is part of the empowerment of seniors. And I just want to say, when we had my first year in the Assembly was in 2010. I wasn't a senior then, but I'm a senior now. And in 2010, we had a $10 billion deficit under Governor Patterson. And one of the first things that we protected in the Democratic Conference in our House was senior centers and other senior services. But I think we have to get the message out to seniors about the vaccine. I think it's still new enough, but it's certainly going to be a topic as we go through it. We need to, get the guidelines down. I assume the governor's office will play a major role for New York State in that distribution. But just going back to the fiscal crisis, I want to also say that we really have to create new revenue. And I know I've been working with Senator Addabbo. We have a lot of revenue we've lost to New Jersey because of sports betting, app-based sports betting, because we have sports betting in New York State, but we are not allowed to have app-based sports betting where people are actually going over the George Washington Bridge and betting on their phone in Fort Lee and then coming back. That's something that Senator Addabbo and I have been fighting for, and I'm hoping that'll happen this year. And we also have to create other new revenue streams. Like if we legalize marijuana, which looks like it's going to happen. It happened in New Jersey. There's an entire tax revenue associated with that. So I know I'm going off tangent, Jeff, but I don't know if I'll get called on again.
I'm trying to hit everybody, of course. Now, Assemblymember Rosick, on vaccinations, any action happening?
Yeah, I think first and foremost, we can, as a point of pride, say that the first vaccine was delivered to or given to a nurse from LIJ Hospital in Queens. I think that is something that we should be celebrating and be proud of as a Queens resident. But really, it's on us as legislators to emphasize the need for language access when it comes to connecting constituents, especially older seniors who may have vaccine concerns. They may not understand how to get the vaccine. What we saw during the pandemic was that our offices were the vehicles for connecting those who are most vulnerable in our communities to services and meeting people where they're at. That's at the bottom line at the end of the day, what's most important. And doing that in their own language in a culturally sensitive way is really important when it comes to talking about seniors within Queens communities. I think we need to be working with city agencies and CBOs in a deep partnership to supplement whatever kind of language access and resources there are out there on vaccine delivery specifically to senior communities.
Thank you. Anybody else on vaccines? If anybody has any Any particular insight? I know there's so many questions and maybe not enough answers at this point.
I would just say that I would want to encourage people to take the vaccine. I'm willing to do it publicly to allay any fears as well. I know most of my colleagues are as well. And, we want to make sure that also people are getting the flu shot. I got the flu shot earlier. We're working with Northwell. We did a flu shot, did 3 flu shot programs with different with both Queens Hospital and Northwell and anyone else that wants to do it in our community so that people don't have to go downtown or to a congested area to get it done. We're working with local churches in our community, but we need to build up the immunity, as herd immunity in a scientific way as quickly as possible. So I think that we need to encourage people to do so. And we've been asked by other folks to do some seminars to ensure that the vaccine is safe, and we're going to be tracking with the different healthcare agencies the effectiveness of the vaccine now that it's being implemented. But it's important that we all take it. We want to get back to normal as quickly as possible.
And Jeff, I think all of us are on the same page about our willingness to educate the community, but I think it's important to recognize that there are many segments of our community that very rightfully don't trust government, the source of where this vaccine came from, or even vaccines in general. So I want us, and at least this is the approach my team is going to take, is going to be about educating and encouraging people so that the more education that's out there, the easier it is for folks to understand that this is a life-saving resource for all of us.
If I may, this is Sanders.
Yes, I've heard Senator Sanders has joined us. I don't think we've got video, but we can hear you well. So please.
Well, thank you. I'll take what I could get, and it's only video, audio. So I want to add and join all of my colleagues, but we also have to go beyond this. We have to understand that this COVID-19 has revealed economic and racial disparities that we have to, as an American people, deal with. These disparities hit especially hard and especially cruel to our seniors. And we need to widen the conversation, not simply this one, but the national conversation as to making sure that there's some type of universal health care, some type of way to ensure that illnesses such as COVID-19 that we will see again, it will have a different name and a different crisis, but we will have this again. We can make sure that we're ready for it next time, even as we deal with the economic inequalities that is part of the American legacy.
Absolutely. Thank you, Senator. I'm glad you could join us. And I will give Assemblymember Kim the opportunity first to respond to the next one. I got to say, look, I'm surprised that you didn't speak about revenue raisers. I know you like talking about that kind of stuff, but I want to bring the topic to nursing homes, talking about disparities. I mean, nursing homes have seen so many deaths from COVID-19. I think the last count was over 6,500 New Yorkers have died in nursing homes during the pandemic. Are you confident that nursing homes are a safe place during the pandemic going forward as we enter a second wave? And what has been done or what should be done to ensure safety in nursing homes?
Well, thank you, Jeff. And thank you to my colleagues for being so good about talking about revenues and taxing the rich. But as far as nursing homes, I want to especially acknowledge AARP, Beth Finkel, and her staff for being at the very beginning of pushing back some of the policies that were put in place and making sure that our residents have full access and rights. And I don't know if you noticed, Jeff and others, in New York, we have what we call a nursing home bill of rights. This is something that we codified into law after the federal government passed. So during this pandemic, it was clear that this administration waived those rights and made unilateral decisions to give blanket, corporate immunity passes to nursing home executives when we should have been holding them accountable and liable. And the Senate and the Assembly came together and we came to the compromise of repealing that in July. high. And I think that definitely had an impact in holding these facilities accountable. But more importantly, now we know what to do and how we should be prepared. So there's no more excuses. And at the core of it, it's all interlinked. We have these facilities that have been understaffed, under-resourced for years. Walking into the pandemic, we cut Medicaid, we cut home care. Not us, not more for the governor. So we learned some valuable lessons on what not to do, and all of it again goes back to revenues. How are we going to hold the ultra rich accountable? We as a state, we are the wealthiest state in the entire country, in the entire world, one of the wealthiest places. We're richer than Finland, Russia as a state. $1.7 trillion of economic activity in the state. So at the core is about how do we break this concentration of wealth to make sure that we have sustainable revenue and not pit programs and not have debates about what program is more important than others. They're all equally important and we should be funding all of it. Thanks, Jeff.
Jeff, I'd like to jump in again if you don't mind. I want to particularly call out Assemblymember Kim, but also Assemblymember Cruz on the long-term care task force and the work that they're doing there. And that's so important. The visitation is really important, but we really need to be keeping our eye on all parts of the long-term care spectrum so that when hopefully this pandemic is simmering down, but as we go through the final stages of it and the next catastrophe that we know will come, we will be better prepared if we have this long-term care task force that really analyzes, looks at the data and everything else. So I just want to particularly thank them for that.
Thank you, Beth. I think, I'm with Ron on this one. Our seniors have given so much to our community. And the least we can do is have the kind of facilities that are really truly caring for them and not politicizing these issues, because this is just about being human and about treating our seniors the way they deserve to be treated. And while we anecdotally each can say, what has happened in our communities with seniors or even in some of these facilities, unless we have the real data, unless we understand who invested what, who took away what, what's really happening, are we really prepared? It's going to be impossible for us to prevent the level of catastrophes that I think there's no other way to call what happened within our senior living facilities to so many of the people that were living there and live there. And I'm looking at a comment that just came in. It is still very scary for some of the seniors to live this way. But for many families, there's no other choice. For many seniors, they don't have a family to look after them. And so they're in these facilities, and the least we can do is give them a dignified life. They're not asking for luxuries, they're asking for dignity. And that is what, if I may speak for Ron, I think that's what he and I have been fighting for, to make sure that these seniors are treated in a dignified way.
Absolutely. And I know so many of you have spoken on nursing homes and long-term care. Any other thoughts on what New York can do as the second wave is coming?
Well, I know that the governor has targeted nursing homes to be on the first line, and also I hope that they ensure that the employees are considered essential workers too, and anyone that's working with a transient community should be considered a essential worker and get the shot as quickly as possible. And I hope that we do make sure that there's tracking on that. And I know that we will be, all of us, checking on the nursing homes that we deal with in the community to ensure that they're actually getting the shots as well. And I would invite any nursing home in Queens that hasn't been contacted to reach out to all of our offices to ensure that we can advocate for you.
I think in hindsight, there were a lot of mistakes made with nursing homes, and kudos to Assemblymember Kim and others for really highlighting the shortfalls of not only what nursing homes were doing, but our state oversight over them. And going forward, some changes in the state law have already been made, with more changes on their way. And so, when COVID first hit us, a lot of us we didn't know what we were dealing with. Now we have a lot more information. And as Senator Comrie mentioned, the vaccine is on its way. There are going to be priorities that have to be made. Eventually, we will all get it. But as they roll it out, the most vulnerable will get it first, and those have to be the people who work and live in the nursing homes.
And if I could just add to that, in my community, I have 12 adult homes. So let's just remember the adult homes. So I have the most in all of New York State in one assembly district, and we have to also include them in these conversations because their budgets, they haven't been increased in years. And again, I totally agree with Senator Lou that there were mistakes along the way. We only can learn. This is our first pandemic. Let's hope we don't have a second that we all could talk about. But for years, we've been fighting to get increases to the adult homes. We always take a stand against the owners and count what everyone has. And I have to say I have great operators here, but they can only do so much. It actually costs more to board a dog at if you're going away for the weekend, than the state gives to people in the adult homes. So what does that say about prioritizing, humanizing, and making priorities? I mean, to have dignity. That's the things we have to look at and support that as a whole. And that's where the revenue we should look at. That's the long term. Again, 50 and over is what your clientele, what you're advocating for. So God bless, everyone should live a good life. That's a lot of years maybe living in an adult home for those who need it. And they do well there. But we have to support that. So as much as we are looking at programs, we have to evaluate our priorities, reevaluate our priorities.
Absolutely. When we have
If I may, Sanders here.
Go ahead.
If I may, I think that all of these things that my colleagues are saying is right, but we have a looming crisis that will hit our seniors harder perhaps than anyone else, and that is the budget deficit that is upon us, $15 billion a year for the next 4 years. This will result in a cut of the same essential workers that we have been all praising, the medical, the EMT, all of these things that will have impact on our seniors' lives and others. So even as we fight for their lives, we're going to have to look at, yes, ways of raising revenues. Perhaps we can take it from these pandemic billionaires, people who have made billions during this crisis, and have a portion of that to make sure that we don't cut the social safety net that these seniors depend on, that we don't cut all of these things, and especially hurtful to the middle class and to our seniors. I, of course, support a stock transfer tax, and I encourage all of us to do this as a way of protecting our seniors and ourselves from the looming cuts. Thank you.
Absolutely. And I wanted to draw from a question in the Q&A that was related to nursing homes and home care. And I'll admit my lack of expertise here. So I'm just basically reading from the question. It seems like an expert, but they're wondering if the legislators are aware of the new Medicaid eligibility criteria for home care services proposed in the recent health budget. And they're saying that it will now actually be harder for people to get home care services or get services in their own home, forcing some to go to an institution instead, which may be a higher risk setting for COVID in institutions rather than home care. So just wondering if anybody has spoken out about this issue and if anybody has expertise here.
Yeah, Jeff, this is that part of the bill, some of us feel like it was unconstitutional. And we were actually, Dick Gottfried is introduced the bill to repeal that because we should be making easier for people to apply for home care. Not only that, but we should also be fully funding home care, especially during a pandemic. So that's an issue that's front and center for many of us, and we're working on along with AARP. And in addition to that, I think we should also make our public benefits as portable and flexible as possible. There's no reason why at the peak of this pandemic, we could have transferred the $800 of Medicare, Medicaid reimbursement instantaneously if the family wanted to take their loved ones back home on that day. That's something that should be examined as well.
Any other thoughts from legislators who have been involved in this issue?
No, I haven't been involved in the issue, but I want to just share some lived experience that might be able to help guide us in a positive direction. Certainly looking at making sure that managed long-term care plans for folks who are chronically ill or disabled, definitely have a lot more funding and support on the state level, because a lot of the times they limit the patient's hours for the at-home care, and the patients might need more at-home hours from their providers. I think that that's important. And secondly, I'm widely uncomfortable with, and I'm not sure the mechanisms here, but I'm widely uncomfortable with the cap that some of the insurance companies have on the over-the-counter OTC allotment that a lot of our folks who are MLTC have. One year, the insurance companies say it's $100. Another year, it's $75. There's a lot of instability there. And there are seniors and there are folks who have MLTC plans that need that continuity, but also count on that additional $100 or $150 per month to buy items that are not within their coverage. Maybe a heart monitor or blood pressure cuff, things like that are not within their coverage range. It's important to make sure that there's continuity with that number. But second from that, making sure that some of those products that can't be purchased with insurance can be purchased through OTC to really provide that additional financial support for our seniors through OTC.
As we're speaking about it, I mean, another question that's at the forefront for many seniors and just many New Yorkers in general is the high cost of prescription drugs and drug plans. Is there any plans on or proposals on the state level to make prescription drugs more affordable?
There are numerous bills and ideas that are being floated about that, and that we are all supporting and working with Senator Rivera on the Senate side, and also Assemblymember Gottfried, as we try to ferret these things out. So we're definitely, the cost of prescriptions are too damn high, and we're doing everything we can to try to figure out a way to help on the state level to lower those costs, and also to review those people that are imposing those high costs as well.
I could jump in here too. I think you all know that drug affordability is one of the top priorities for AARP New York, and we've had a lot of support in both the Senate and in the Assembly. Drug reimportation from Canada is the piece that the governor's been working on. We're also concerned about the future of EPIC, and I know that you all know that EPIC is important to your constituencies, so we're looking the new new budget season, looking to protect that, and also the pay to delay deals that are going on, which is just abhorrent, that drug companies are paying other companies to keep their generics off the market, delay them by a year, or more, which we know what that does to the cost of drugs. If people have to buy the brand name and they can't buy the generic when they're just as effective, it doesn't really make a lot of sense. So we are, AARP is a staunch advocate on this, and looking forward to continuing to work with all of you on these drug affordability issues.
Yeah, we've been also very focused on cracking down on PBMs, the pharmacy benefit management companies. They have monopolized the space as an intermediary. There's only 2 major operators in the entire country that's in charge of distributing the drugs and the pricing points, while hurting the mom and pop small business pharmacies in the process.
Mm-hmm.
We've been going after them for a couple of years now, but this is a giant industry. And I know that Senator Skoufis has tried to send some subpoenas to these companies, and it's been very difficult. But that's something that we need to refocus on, because they control the pricing point and they should be held accountable.
Mm-hmm. I have couple of PBM bills going after the pharmacy benefit managers. It's a wasted a monopoly, and I don't know how they got started, and rooted within the state, but they need to be eliminated altogether.
Agreed 100% on that. I mean, and Ron, you hit it on the head. It is also our small businesses. It's our Main Street businesses. It's the guy that we know, the pharmacist that helps us out when we have those questions. It's who are, especially in Queens where there's so many language barriers or concerns, that's the person who helps out locally in your neighborhood. It's your neighborhood person, and they are just being priced out of their own business. So whatever we could do, I'm 100% supportive of it, but on every legislation that is being offered, we have to break up that monopoly. So Senator Comrie, you gave me work already this afternoon. I'm looking for those bills as soon as we get off.
I'm sure my friend Stacy, they were thinking about Stu, our local pharmacist down in Rockaway. And all you have to do is talk to your local pharmacist. I mean, these are struggling individuals who are just trying to help others, but the thumb is on them. And obviously they're suppressing the rate in which they get reimbursed. And I agree with my colleagues, Kim and Comrie, about the PBMs. I mean, the bottom line is, they have the stranglehold on the whole industry. And the problem is it's very hard for the local pharmacists to come from underneath these PBMs. They have to be regulated. Other states have done it. We are slow to do it. And unfortunately, to that point, hopefully we can work with this governor's administration to address the PBM issue and help all local pharmacies.
As we're talking about drugs, and I do want to say we have a few more topics I want to get to, so let's try and hit these quickly. But as we're talking about drugs, what everybody's wondering is, will marijuana be fully legalized in New York in this upcoming session? So wondering if any of you have an update on that or any thoughts on whether cannabis should be fully legalized in the state.
Well, I'll jump in. I'll jump in, Jeff, if that's okay. I mentioned it before. Clearly, New Jersey, I think, is pushing us to move faster. Because New Jersey, of course, had a referendum on the ballot and legalized marijuana. We've already decriminalized marijuana. We've had recreational marijuana for a number of years. I don't see, and I think the governor has made statements, that he hadn't made before, basically saying he would support legalizing marijuana. So I don't think it's a question of will we, I think it's a question of when. And it's also a question of how we maximize that revenue, because we're clearly in a fiscal crisis at the New York State level as well as the New York City level, and I think there is room for significant revenue with the marijuana. And of course, we want to help those communities that have been disproportionately affected by enforcement and incarcerated for marijuana infractions. Black and brown neighborhoods. I chair the corrections committee. I've seen it firsthand. We've obviously repealed the Rockefeller drug laws. We've made a lot of changes, but I think there is a move to actually help some of those communities that have been disproportionately affected by enforcement of the marijuana laws. But I don't see, I'm certain that we are going to be legalizing marijuana, at least with the present makeup of the Assembly and the Senate. And I think we have to see how we can maximize the revenue attributed to it.
I think there was already political will to legalize recreational marijuana years ago. It's just the details that need to be worked out, not only maximizing the revenues, but also making sure that as Assemblymember Weprin mentioned, the communities that suffered from these outdated marijuana laws actually are able to get some empowerment, specifically economic empowerment from that. The whole, more and more states every single year legalize recreational use. Our big neighbor to the north has legalized it. There's no reason why we should continue to criminalize something that, the scientists and doctors themselves have said is no more addictive or dangerous than alcohol. We allow alcohol, we tax and regulate it. We should do the same for marijuana, and the revenues will help. But let's also be clear, all these revenue sources, I support the gaming revenues, the online sports betting revenues as well. But none of these revenues are going to get us out of the hole that we're in. At the end of the day, I don't want to make any bones about it. It's going to take personal income tax, and it's going to take personal income tax from those who are able to pay it, meaning those who make in the millions.
Now, one issue that has really become exacerbated by the pandemic is broadband internet and just internet access. I've been covering the mayoral race here in New York City, and I've been almost a little surprised at how many candidates are really talking about broadband access, bringing that forward, talking about that as a main issue. All of you work in Albany. Is there anything that can be done on the state level to make quality internet service more accessible and affordable as so much of our lives have gone online in this past year?
Yes, we have bills. I have a bill that's dealing with the fact that these broadband companies have not been servicing the state in a proper way. It's horrible that we have people in the city that can't get access. Young people can't get online to get educated. Seniors are not getting more accessible opportunities. And these companies are making money hand over foot during the pandemic. So we have bills that are on it. We talked about it extensively in our Senate conference last week, and we will be focusing on it. Upstate and rural communities, especially, you have limited broadband access where you have children that can't even get online in upstate communities. So, there's a major problem. And, even though the governor has, for whatever reason, not embraced this issue and has said that most of it had been resolved, in reality, none of it's really been resolved, especially in minority communities. So we will be dealing and focusing on it. We have bills that are requiring the broadband companies to provide access to every school to improve their Wi-Fi resources and the high-speed resources at every school, and also to make sure that every minority community or any child where the income is below the poverty rate, that they get full high-speed Wi-Fi services, especially since we're focusing on in-service learning, indoor learning right now. And
our colleague, Senator Shelley Mayer, who chairs the Education Committee, just introduced a new bill a couple of weeks ago that will call for internet service providers in the state of New York to provide that free broadband anywhere in the state for school children, as Senator Comrie mentioned. And it makes sense because number one, it won't cost taxpayers anything. And number two, it will come out of it will be funded by those very same internet service providers who, quite frankly, have done very, very well in this pandemic when people are relying on broadband and internet access much, much more. So we need them to pay to make sure that the next generation of New Yorkers is well educated.
And I think, Jeff, and thank you for that, Senator, and to the rest of my colleagues. I think that one thing now we're getting close to touch on directly is the digital divide that's being experienced by our elderly, our seasoned citizens, as I like to call them, and folks who live in areas that are not covered with internet. And so when we're talking about the digital divide, we need groups that don't otherwise have access to the internet who need it and need that access. I know earlier this year, NYCHA did a lackluster, to say the least, program that provided tablets to senior citizens in developments across NYCHA, across the city. Of course, they didn't reach my district, but nonetheless, this is a way that we can help bridge the tech divide by one, providing that technology, but two, making sure that we expand broadband to communities that otherwise wouldn't have it, and communities that are experiencing this disparity. So programs like that help, but we definitely need stable anchors so that we always have a go-to to be able to help seniors who need access to technology. And then secondly, as well, when we're talking about, and it relates, when we're talking about senior centers and day treatment centers where seniors go, daycares. A lot of what was a part of folks' routine of going to the daycare center and socializing has been taken away. And they're moving over to remote services where they have their senior services remote. But if you can't access it, you're losing that very important component of socialization, which our seniors need to be more active. And so that it affects us in more than one way, both socially, economically, it affects us. And this is something that we need to address.
I want to give Beth Finkel an opportunity to respond to this too, whether it's with broadband or also am I missing any other big AARP priorities here? What are we talking?
Oh, I do want to talk about broadband. I'm so glad you all raised that. We actually are hoping that the governor will put forth a study to really look at where broadband is and it isn't. You know, right now you get all these reports from a lot of the carriers saying, oh, it's covered everywhere. We've got it everywhere. And of course, we hear from time to time, oh, well, in rural areas, it's a problem. But we all know, you all know, because you've already stated that it's in your communities too. And I think part of that is the way it's been measured, which is looking within census lots rather than going really carefully locally, block to block and building to building, because they make it seem like it's on the census block and you're fine, but in fact the coverage is not there. We absolutely need to do that. I also want to go back to a point that we heard earlier about disparities and the importance of disrupting disparities. AARP has been working on this quite a while, and a number of you were with us early on and have spoken with us on it. But in these COVID times, it's even worse. We put out a report, 3.0 on disrupt disparities, focused on 3 areas that got hit really badly by COVID. And again, I know you all know this, but health, nursing homes, with at least a quarter of Black or Latino residents here in New York State have been twice as likely to be hit by COVID-19 than those nursing homes that have 5% Black and Latino residents. So there's a terrible insecurity. We've been talking about hunger. Again, it's even worse for communities of color. 39% of Black families and 37% of Hispanic families are struggling with food insecurity. Now we know 25% of all New York City homes are struggling anyway, but it's just that much worse. And we also know that in the Asian community across the board, all of these areas are hurt even more. And what's so troubling in the Asian community is that there is a dearth of research. I've been at this for quite a while, and I can grab numbers for African American, Hispanic, but I cannot grab numbers for Asian. And I'm looking across the board, across the United States. I have my AARP nationally looking at trying to grab some of these numbers in the Asian community. They're not there. And we just can't continue to tolerate that. We need to be able to count what's happening in the Asian community also. And then I just want to follow up on housing because I know that is front of mind for a lot of people. You've all worked really hard on the rent moratoriums and also mortgages and everything else, and utilities, I should mention too, looking at the cutoffs, because that's such a big concern for all of us. But about 25% of Black and Latino families reported not being able to pay their rent as of May of this year versus 14% of white households. And we know this has only gotten worse. But this is the number that really gets me. 50% of Black tenant households in New York State fell behind on their rent by late May and early June. So 50% of people in that community have fallen behind. And again, we don't have all the data that we need, and we're still digging for it. And if you all have more data for us, please contact me. Really would welcome it. I know that you're all fighting the good fight on this, but I just needed to share this. We have reports, and I think they've been sent to all of you, and be happy to send them out again so you can see the areas that we're looking that have really been hit by COVID. And I just want to thank you all for all your efforts, really.
And thank you, Beth. A couple notes from city and state. Just want to say that tomorrow at 12:30 is our first virtual legislators retreat. Assemblymember Anderson, I hope you're there, but really everybody is invited, and not just lawmakers, just anybody in the general public who wants to learn a little bit about how Albany works. Attorney General Tish James is going to be giving a speech, so virtual legislators retreat tomorrow, Tuesday, and then on Wednesday we have a Responsible 100 virtual luncheon keynoted by the Reverend Al Sharpton. So if anybody's running for mayor, go there, talk to Al Sharpton. But also now wanted to quick throw it over once again to, I hope she's still on, Heather Joseph of AARP with some closing remarks. You there, Heather?
I am still here. I'm just going to turn on my camera really quickly for you guys. This was a phenomenal session. Thank you very much, Jeff and City and State, for moderating today's Queens State Legislative Forum. Thank you to all of our state legislators for taking the time out of your busy schedules to speak with us. And thank you especially to all of our members and Queens residents for joining us today. I hope you found this conversation informative. I certainly did. I was taking notes as we were listening today. We are in uncharted waters, and the decision our elected officials make and the policies they enact are sure to have far-reaching effects beyond the period and the remainder of this pandemic. I hope each of you feels better, equipped, and informed to make your own decisions and take your own actions, which will certainly inform and impact the decisions and actions each of our elected representatives have made. Thank you again, and have a wonderful and fantastic day. Be safe.
Thank you. Thank you, City and State.
Thank you.
Thank you, AARP, for sending me an invitation to join every 15th of the month. That tote bag is getting more and more attractive to me.